Welcome to our Line Opinion panelists for the week. Always great to see Dave Mulryan. He's president of Mulryan Nash Advertising. We have Julianne Grimm, editor and publisher at the Santa Fe Reporter, and Ed Perea, attorney and public safety consultant. Thank you all for being here. All right, a new series from the Albuquerque Journal highlights many of the shortcomings of our behavioral health system in Bernalillo County, but also the entire state. Those articles show some of the systemic failures, but also make it clear our need here in New Mexico is greater than in most states. And Dave, we rank in the bottom 10 states when it comes to the general prevalence of mental illness among residents. That's as the state, as you know, is investing $930 million this fiscal year alone to improve behavioral health outcomes. It doesn't seem like a money issue, does it? Or is it, after all?
You know, that was one of the things that was somewhat depressing when they were pointing out that, you know, in terms of funding, we do pretty good. We as a state, we do pretty well in how much we do fund. It's just that our outcomes are not that good. And I think one of the other articles that we read, you know, as sort of background today was, you know, are we missing professionals in our state and local governments? And in some ways, I think that, you know, it's not just about throwing money at the problem, although money does tend to help. But I think that new ideas and try things that we haven't tried before are also helpful. And also, I mean, I want to defend the state somewhat and say, I think one of the problems that New Mexico has is because we're such an enormous state, it is difficult to sort of, you know, get boots on the ground where you need them and to see everything. So in some ways, geography is destiny. And I think that's a big part of our problem. It is very difficult to you know, administer these statewide programs when you're having to deal with places like Albuquerque and having to deal with places like Raton, you know, with 2,400 people in the state, in the city or the town. And I think that those types of differences mean that you're going to have, you know, programs that work both on a small side and when you have to supersize them too.
Julianne, Dave makes an interesting point about geography. Obviously, the Rio Grande corridor seems to have most of these services. We got a lot of money out here for this. Is this the time to make this situation just much more manageable for folks in rural parts of our state?
Well, I think it's long past time for, you know, people in rural communities to have adequate access to healthcare of all kinds. And certainly that is the biggest challenge area. I think it's the one that, as you mentioned, it is the staffing shortages that are plaguing all of our medical services are particularly acute for behavioral health, you know, substance use treatment, even things like, you know, I think we're going to talk about a little bit later, youth services to help to mitigate some of these long-term problems people can develop if they're not addressed with adequate services for youth. So I think there's a lot that, you know, still needs to be done. And I sort of sympathize with this idea that you want to leap to the defense of New Mexico and say, look at all the money we're spending and look at all of the problems we have. But that just feels thin. And when you consider the need that we have, and clearly our government, you know, our communities are not doing all that we need to do to meet those needs.
You know, Ed, interesting that Julianne brings up money here. One of the things the report was just so mind-blowing is just how much money we have spent so far with kind of not much result. I mean, the state tripled spending on substance abuse treatment and increased services delivery by 85%, but analysts said that in the same time frame, the alcohol-related death rate, drug overdose deaths, violent crime rose 49, 43, and 30% respectively over those years. So I ask again, is it a money issue? Not enough money is being spent? How should we consider the money angle here?
Well, Gene, it's not the money issue. Clearly, by all the data that we've received, there's plenty of money. The citizens of New Mexico, Bernalillo County, have been taxed in order to specifically address these issues. And so there's money in this pot to start addressing the issues. The problem appears to be the organization and the coordination. There seems to be a lot of individuals involved in the various component parts of this process, but not one person who might be able to pull all the actors and all the different agencies together. You know, it's been written that this whole process seems to be a little bit disjointed, that there are just a lot of little pieces that are taking place. Well, there doesn't appear to be a major concern about services. If you look at the data, it seems to be that there are many services available, but it's the implementation and the outcomes of this treatment that is the biggest concern. And so I agree with the others that money isn't necessarily the issue here. The resources are there, but how are we managing it? What's the leadership behind, and what are the ultimate objectives? I'm not sure if the criteria has been very, very clearly spelled out. That's been one of the other criticisms. Is that what is the criteria? What are the metrics that we're measuring? And that's not clear out there.
That's a good point. Dave, substance abuse, alcohol play a large role in this too. We recently hosted a roundtable discussion on the impact of alcohol in our state. What role, I got to ask here, what role do primary care docs play here? Meaning, in terms of understanding someone's substance abuse problems as a mental health issue that needs attention from a specialist. We hear from people all the time that's the break, the leap that has to be made.
I think one of the things that you hear over and over and over again is that substance abuse cannot be separated from overall health care. And so one could make the argument, or I'll make the argument, maybe we need to concentrate on simply increasing health care at all levels, increasing access. Although, we've done a pretty good job. We went ahead and voted for Medicaid to expand it. But, possibly we simply need to, make overall health care better and, improve the idea of, can we get substance abuse to be, I think it plays a huge role in it. If we can do that, maybe that's one way to sort of attack the problem, maybe fund the healthcare part of it more than we fund specifically those areas. I don't know. I'm not an expert on it, but that would be at least something to try.
Good point there. Julianne, one of the potential solutions the state has pointed to is the expansion of the new 988 crisis hotline. As we all know, or should know, September is Suicide Awareness Month, and the state has been promoting this through this month, of course. Now, will that hotline have the positive impact the state is hoping for? That's a hard thing to sort of break to the public statewide, that we have a new, phone number. You're going to spend a lot of money to do those kind of things, but is this a good idea?
Well, I think people are most familiar with it because it caused us to all have to start dialing the area code when we call anyone else in the 505. That's probably the biggest difference that made people aware of it. But I don't think that type of thing is a silver bullet, really. To your point about, could primary care providers help with this? I think that the idea that most people who are struggling with substance abuse and other behavioral health issues, that they have access to primary care, that's not really true. And so we really don't have that baseline, and we don't have systems that are addressing the root causes and, again, giving people support sort of before things get to a crisis level. I think the other thing that you see people doing, the governments are always talking about, let's establish this crisis center. Let's have the one-stop shop for every behavioral health need ever. And we've seen that A, those things don't get built. When they do get built, B, they don't really work. When the Santa Fe County facility that was just built and the Bernalillo facility that's supposed to go in 2024, they both have less than 30 beds each.
Wow. That
doesn't seem like a big enough dent given the problem.
Yeah, that's two key points there. That's not going to put much of a dent. Ed, interestingly, an attorney with the group Disability Rights New Mexico, this is an interesting point here, says that part of the problem, we're not proactive enough before there is a crisis, meaning the state is underusing Medicaid mandated early periodic testing screening, for example, as well as diagnosing and treating children under 21. How important is it to get to our kids early on this issue, and do we have to set up a framework to do this?
Gene, that's incredibly important. The three approaches to dealing with what can be a potentially serious problem is prevention, intervention, and treatment. And prevention is the most critical piece of this. And if we're not focusing our energies, if we're focusing too much energy on the back end, we've already failed at the front end. The focus needs to be, and granted, we need the appropriate resources in intervention and treatment, but prevention has to be at the forefront of all we do. And as we look at how our money is being spent, we need to put a premium on our prevention measures. What are we doing? What sort of outreach? Because sometimes mental health illness sneaks up on families, sneaks up on individuals before
Good
we
point.
see it. So what type of outreach are there so when this happens, that those that are affected by it know how to access those resources? And so prevention, getting the word out in order to ensure that as these issues arise on the front end, that they're easily available, attainable, and accessible. And so again, prevention is key. There must be framework. I'm sure that those organizations that are looking at our approach to the mental health issues in this state are looking at prevention, although I haven't seen a lot of research
Right.
as far as how much work that they put into it. I'm sure that it's out there. I'd like to see more of it.
Prevention's a tough one. It's a tough one. It's a buzz phrase, buzzword, but it's awfully hard. Thanks to our line opinion panel for your input on the mental health situation here in our state. We'll be back here with the panel again in less than 10 minutes to talk about new funding for law enforcement recruiting and why one major New Mexico city won't be getting any of that money.